There is a number I share with every new patient who sits down across from me, and without fail, it stops them cold. 90%. 90% of people who have chronic kidney disease right now, as you are watching this video, have absolutely no idea. No pain, no swelling, no warning. Their kidneys are quietly losing function month after month, and their daily routine is completely unchanged. They wake up, they drink their coffee, they take their medications, they feel fine. And the whole time, silently, steadily, their kidneys are failing. The reason this is so dangerous, and the reason it is so common and so consistently missed, is not because the signs are invisible. The signs are there. They are present in millions of people every single day. The problem is that the signs are quiet. They are easy to dismiss. They feel like aging. They feel like a long week. They feel like something that does not require a phone call to a doctor. And so people wait. And while they wait, the damage accumulates. And by the time the symptoms become impossible to ignore, a significant portion of kidney function that will never come back is already gone. My name is Dr. Favor Clinton. I have over 10 years of clinical experience, and I have dedicated a significant portion of my career to the early detection and management of kidney disease. I have sat with patients at every stage, from the earliest detectable signs all the way to dialysis. And the conversation I have most often, the one that leaves people the most shaken, is not the one where I explain what dialysis is. It is the one where I have to tell someone that we could have caught this years ago, if only they had known what to look for. That is the conversation this video is designed to prevent. Today, I am going to walk you through 7 signs that your kidneys may be in serious trouble. Some of these you may have heard before. Others will surprise you. All of them are documented, clinically recognized warning signs that are missed every single day because no one has taken the time to explain what they actually mean and why they matter. Stay with me through all 7, because the difference between catching kidney disease early and finding out when it is already advanced is not a matter of luck. It is a matter of information. And after today, you will have that information. Before I walk you through the 7 signs, I need you to understand something about your kidneys that most people were never taught in school and that most doctors never have the time to explain in a standard appointment. Your kidneys are not simple organs. They are not just responsible for producing urine and sending it out of your body. They are among the most sophisticated, continuously active, metabolically demanding organs in the entire human body. Every single day, your kidneys filter approximately 200 liters of blood. 200 liters. Every drop of blood you have passes through your kidneys roughly 40 times in a single day. As it passes through, the kidneys sort it with extraordinary precision. They retain what you need, they discard what you do not, and they maintain a delicate balance of minerals, fluids, and chemicals that every other organ in your body depends on. Your kidneys regulate your blood pressure through a hormone system called the renin-angiotensin-aldosterone system. When that system is working correctly, your blood pressure stays in a range that protects your heart, your brain, and your blood vessels. When it goes wrong, blood pressure climbs in ways that are difficult to control even with medication. Your kidneys produce a hormone called erythropoietin, which signals your bone marrow to manufacture red blood cells. Without enough of that hormone, your body becomes anemic. And anemia means every cell in your body, your muscles, your brain, your heart, all of them start operating on reduced oxygen. Your kidneys activate vitamin D, which regulates calcium absorption and bone health. They control potassium levels, which determine how your heart beats. They manage sodium, which controls how much fluid your body retains. Now, here is the part that is both remarkable and terrifying at the same time. You can lose 50 to 60% of your kidney function, more than half, before your body produces a single symptom that is clear enough to make you pick up the phone and call a doctor. The kidneys have what scientists call enormous reserve capacity. They are built to keep working even as they are failing. This is why the signs I am about to describe are so important. They appear before the damage becomes catastrophic. They are the body's way of whispering that something is wrong. And in medicine, a whisper you hear early is worth far more than an alarm that goes off when it is already too late. I want to tell you about a patient I will call Gerald. Gerald was 64 years old when he first came to see me. He was a retired logistics manager, organized, methodical, careful about his health by most measures. He had been managing borderline high blood pressure for 3 years with medication. He walked every morning, and he had his annual blood work done without fail. He came to me not because he suspected something was wrong with his kidneys. He came because he had been feeling unusually tired for the better part of a year. He had put it down to the adjustment of retirement, to the restlessness of a man who had spent 40 years with structure and purpose and was now navigating a quieter life. His GP had checked his thyroid, normal. His iron levels, normal. His B12, normal. He was told it was probably stress, probably sleep quality, probably just life. When I ran a full kidney function panel on Gerald, his estimated glomerular filtration rate, the key measurement of how efficiently his kidneys are actually filtering his blood, had fallen to 48. Normal for a man his age should have been above 75. Gerald had stage 3 chronic kidney disease, and he had been living with it, symptom by symptom, dismissal by dismissal, for an estimated 2 to 3 years. When I went back through his history with him and asked him specifically about each of the 7 signs I am about to describe, he recognized 5 of them. 5 out of 7. Each one had been present. Each one had been dismissed as something else. Each one had been a message from his kidneys that no one had helped him decode. Gerald did not need dialysis. We caught it in time to slow the progression significantly. But he sat in my office after that diagnosis and said something I have never forgotten. He said, "Doctor, I knew something was off. I just didn't know what I was looking for." That statement is the reason I make videos like this one. You are about to know exactly what to look for. This is the sign that carries perhaps the most diagnostic weight of all 7, and it is the one that the greatest number of people notice and then completely ignore. When you flush the toilet and you see foam or persistent bubbles in the water, bubbles that take more than one flush to clear, that is not nothing. That is your kidneys sending you one of their clearest available signals that something is wrong. Here is what is happening. Your kidneys contain millions of tiny filtering units called glomeruli. Their job is to filter waste products out of your blood while keeping the things your body needs, particularly proteins like albumin, safely inside your bloodstream. When the glomeruli are healthy, almost no protein passes into the urine. When they are damaged, that barrier breaks down. Protein begins leaking through into the urine. That leaking protein is what creates the foam. Albumin, the primary protein in urine when this happens, is the same protein found in egg whites. When you whisk egg whites, they foam. The same principle is happening in your toilet. The foam is literally albumin foaming as it passes through the turbulence of flushing. This condition is called proteinuria, and it is one of the most reliable and earliest measurable signs of kidney damage recognized by nephrologists worldwide. The National Kidney Foundation recommends a specific urine test called the urine albumin to creatinine ratio, or UACR, to detect and measure it. This is not a complicated test. It is a simple urine sample, but it can reveal kidney damage that no blood test will catch at the same stage. If your urine looks persistently foamy, do not wait. Do not tell yourself it is the soap from the toilet cleaner. Do not tell yourself it is just the way the water moves. Ask your doctor for a UACR test. One conversation, one urine sample could tell you everything you need to know. When the kidneys are not working properly, they lose the ability to regulate how much sodium and fluid your body retains. That excess fluid does not stay in the bloodstream where it belongs. It migrates into the surrounding tissues, and it accumulates in the places gravity pulls it. During the day, when you are upright, that means your feet and ankles. You may notice that your shoes feel tighter than they used to, that your socks leave deep impressions in the skin of your ankles when you take them off at night, that by the end of the day, your feet look different from how they looked in the morning. This swelling, which doctors call edema, is your body telling you that fluid management has broken down. In the morning, when you have been lying flat all night, the fluid redistributes, and you may notice it around your eyes. Puffy, swollen tissue beneath and around your eyes when you first wake up is a specific indicator that protein is leaking from the kidneys into the urine. When protein levels in the blood fall because they are being lost through damaged kidneys, the blood loses its ability to hold fluid inside the blood vessels. That fluid leaks into the surrounding tissue, and gravity pulls it to wherever you have been positioned while sleeping. I want to be clear that swelling has other causes. Heart disease and liver disease can both produce edema. That is exactly why this sign must be investigated, not dismissed. Swelling that appears consistently in your feet and ankles, or that you notice around your eyes in the morning with regularity, is not a cosmetic issue. It is a signal that something systemic is wrong, and kidney function should be among the first things checked. This was Gerald's chief complaint when he came to see me. And it is the sign that sends more people down a long road of misdiagnoses, treated for everything from depression to burnout to thyroid problems, before someone finally thinks to check the kidneys. The fatigue associated with kidney disease is not ordinary tiredness. It does not respond to an early night. It does not lift after a good weekend of rest. It is a deep, persistent physical heaviness that people describe as feeling like they are moving through water. A fog that does not clear. A body that feels like it has been working twice as hard as it should just to get through a normal day. There are two mechanisms behind it. The first is the accumulation of waste products in the bloodstream. When the kidneys cannot filter efficiently, urea and other metabolic waste products build up in the blood. These toxins affect the brain and the muscles directly. They impair cognitive function. They slow muscle response. They create the sensation of heaviness and difficulty concentrating that patients often find as debilitating as any physical pain. The second mechanism is anemia. As kidney function falls, the kidneys produce less erythropoietin. Less erythropoietin means the bone marrow receives a weaker signal to produce red blood cells. Fewer red blood cells means less oxygen is being delivered to every cell in the body. Your muscles run on oxygen. Your brain runs on oxygen. Your heart runs on oxygen. When the delivery system is compromised, every system in the body starts running below capacity. This is called renal anemia, and it is one of the most common and most debilitating complications of chronic kidney disease. If you have been experiencing fatigue that sleep does not fix, and if you have been told repeatedly that your standard blood tests are normal, ask specifically for kidney function tests. Not every standard blood panel includes them. You may need to request them by name. Healthy kidneys have a remarkable ability that most people take entirely for granted. During the night, while you sleep, they concentrate your urine. They hold back water, reduce the volume of urine they produce, and allow you to sleep through the night without your bladder demanding attention. This concentration process is one of the kidney's most elegant functions, and it is one of the first to break down when kidney function begins to decline. When the kidneys lose the ability to concentrate urine effectively, they begin producing more dilute urine throughout the night. Your bladder fills more quickly. You wake up, you use the bathroom. You go back to sleep. You wake up again an hour later. This condition is called nocturia, and while it is commonly attributed to prostate enlargement in men, bladder weakness, or simply getting older, it is also a well-documented early sign of declining kidney function. The key indicator to pay attention to is change. If you have always gotten up once or twice a night, and that has been stable for years, that is one thing. But if you have recently begun waking up 2, 3, or 4 times a night when previously you slept through, and if that change has persisted for more than a few weeks, your kidneys deserve to be part of the investigation. Nocturia on its own is not a diagnosis, but in combination with any of the other signs on this list, it becomes a meaningful piece of a pattern that points toward the kidneys. Of all 7 signs, this is the one that catches people most completely off guard, and it is the one that sends people most reliably in the wrong direction for the longest time. When kidney function deteriorates significantly, the kidneys begin to lose the ability to manage mineral balance in the blood. One of the minerals that accumulates is phosphorus. As phosphorus levels rise in the bloodstream, the excess begins to deposit in tissues throughout the body, including the skin. And when phosphorus deposits in the skin, it causes an itch. But this is not an ordinary itch. It does not have a visible rash. It does not respond to moisturizers. It does not respond to antihistamines. It does not go away when you scratch it. Patients describe it as a sensation that seems to come from somewhere beneath the skin's surface, a deep, crawling, inescapable irritation that no topical treatment can reach. This condition is called uremic pruritus, and it is one of the most distressing and most consistently underdiagnosed symptoms of declining kidney function. It is worse at night. It tends to affect the back, the arms, and the legs most severely. People spend months and sometimes years being tested for allergies, dermatological conditions, and autoimmune disorders, when the actual cause is a kidney that can no longer manage phosphorus balance. If you have persistent itching that no skin treatment or antihistamine has touched, and if no dermatologist has been able to identify a clear skin-based cause, please ask your doctor to check your kidney function and your serum phosphorus level. The test takes minutes. The information it provides could redirect your entire treatment path. Recommended length, 150 to 200 words. Connect the product to kidney health, blood pressure management, or a related topic that serves your audience of adults over 60. Follow the competitor's model. Mention limited spots, a discount for your community, and a personal follow-up offer. This sign tends to appear in the later stages of kidney function decline, but it is worth understanding early because when it appears, it represents a serious escalation in how overloaded the kidneys have become. When the kidneys can no longer filter waste products from the blood efficiently, a group of compounds called urea and uremic toxins begin to accumulate in the bloodstream at levels that the body cannot manage internally. The body then begins attempting to offload some of these waste products through whatever channels it can. Two of those channels are the lungs and the saliva. The result is a persistent, unmistakable metallic taste in the mouth that people describe as tasting like old coins, like chemicals, or like something unnatural that does not go away no matter how many times they brush their teeth. The breath can develop a similarly distinctive ammonia-like or urine-like odor, which is the body exhaling uremic compounds through the lungs. This condition is called uremia, and it is a sign that the kidneys are severely overloaded. People frequently attribute this taste and odor to dental problems, acid reflux, medication side effects, or diet changes. And sometimes those are contributing factors. But if the metallic taste or ammonia breath is persistent and does not respond to dental care or dietary changes, kidney function must be investigated immediately. The tests you need are a serum creatinine level and an estimated glomerular filtration rate, or eGFR. These are blood tests that your GP can order at your next appointment, or sooner if this sign is present. Do not delay. This sign in particular warrants urgent attention. Most people understand that high blood pressure damages the kidneys over time. That is true, and it is important. But the relationship is not one-directional. Damaged kidneys also cause high blood pressure, and that bidirectional relationship creates a cycle that accelerates damage in both directions simultaneously, which is one of the main reasons kidney disease can progress so rapidly once it takes hold. Your kidneys regulate blood pressure through two primary mechanisms. First, they control how much sodium and fluid the body retains. Excess sodium and fluid means higher blood volume and higher pressure. Second, they regulate a hormone system called the renin-angiotensin-aldosterone system, which controls how tightly or loosely the blood vessels constrict. When the kidneys are damaged, both of these systems malfunction at the same time. The kidneys retain too much sodium. The blood volume rises. The hormone system drives blood vessel constriction. The result is blood pressure that is not just high, but resistant, difficult to bring down, requiring multiple medications, multiple dose increases, and still not reaching target readings. If your blood pressure has suddenly become harder to control than it used to be, if you have recently needed a medication change or an addition to your blood pressure regimen without a clear lifestyle explanation, or if you are already on multiple blood pressure medications and your readings are still not where they should be, kidney disease should be specifically investigated as a contributing cause. A simple blood test and a urine test can answer that question directly. 7 signs. Foamy or bubbly urine. Swelling in the feet, ankles, or around the eyes. Persistent fatigue that sleep does not resolve. Waking at night to urinate more frequently than usual. Persistent itching with no visible rash. a metallic taste in the mouth or ammonia-like breath, and high blood pressure that is resistant to control. Not all of these will be present in every person with kidney disease. Other conditions can produce many of these same symptoms. That is exactly why I am not asking you to diagnose yourself. I am asking you to take these signs seriously enough to have a conversation with your doctor and to ask for two specific tests. The first is an eGFR, estimated glomerular filtration rate. It is a blood test that estimates how efficiently your kidneys are filtering your blood. The second is a UACR, urine albumin to creatinine ratio. It is a urine test that checks whether protein is leaking from the kidneys. Together, these two tests can detect kidney disease in its earliest, most treatable stages. According to the 2024 KDIGO clinical guidelines, the most current and comprehensive guidelines in nephrology, both tests should be run together because each one catches cases that the other can miss. If you are over 60, if you have diabetes, if you have high blood pressure, if you have a family history of kidney disease, or if you have heart disease, these tests should be part of your annual routine. Not optional, routine. Do not wait for the signs to become impossible to ignore. By the time they are impossible to ignore, the window for the most effective intervention has often already closed. I want to ask you something directly, and I genuinely want your answer in the comments below. Which of these 7 signs have you experienced and dismissed as something else? How many of them, looking back now, were present before you realized what they might mean? Those comments matter. They help me understand what to focus on in the next video. And your experience may be exactly what someone else watching right now needs to hear to finally pick up the phone and call their doctor. If this video gave you something useful today, something you will act on or share with someone you love, please share it. Not for this channel, for the person in your life who is over 60 and has been dismissing these signs for longer than they should. That share may matter more than you realize. Subscribe if you want to continue this conversation. Next time, we are going to talk about something that affects millions of people over 60 who take medication every day and have no idea the damage being done. You will not want to miss that one.